Fat grafting is an auxiliary process that we use. It's an adjuvant. It's something that we add to the process of breast reconstruction. It never, in my particular practice, is the primary method of breast reconstruction. In fact, using fat grafting as a primary source of breast reconstruction is something that was considered in the past, but most practitioners of breast reconstruction do not believe that it has a role of making the primary breast mound the breast reconstruction itself. However, fat grafting can help other methods of breast reconstruction. When we're using autologous tissue reconstruction, i.e. the DIEP flap, adding fat after the initial DIEP flap procedure can help round out the edges, if you will, fill in some of the areas where the DIEP flap did not fill in the mastectomy skin. And also when we're doing an implant-based breast reconstruction, a reconstruction where we're using a tissue expander followed later by an implant, fat grafting plays a very important role in filling in parts of the reconstructed breast that the implant itself does not fill out. If you think about it, all of the implants that we're using today are round, but breasts aren't round. Natural breasts are more of a teardrop shaped, and the upper outer part of the breast along the chest wall is the area where the implant doesn't fill out the breast that's been reconstructed, and fat grafting can be very helpful there. The way that fat grafting is carried out is that during the second stage of breast reconstruction, where we remove the tissue expander that was placed at the first stage and replace it with an implant, we do an additional procedure at that same time. That additional procedure is the fat grafting procedure, where while the patient is still asleep, after we have decided what size implant we're using and we've placed a temporary sizer, we use liposuction, just the typical process of liposuction, to remove fat from usually the flanks, sometimes the inner and outer thighs. We process that in a way so as to help prepare and separate only the most helpful fat, and then we inject that fat into the parts of the breast where the implant won't fill it out. The reason that we do that with the temporary sizers in place is that there is the potential of injuring the implant. So we do it with the sizers in place. Then the final step in that second stage of breast reconstruction is removing the sizer, replacing the implant, and closing the skin. Again, all done after the fat grafting has been performed.